Let's see if we can pull out some themes from these regional reports, and also go away with the opportunity to think about things that are specific to our own regions. While people are gathering their thoughts, I mentioned that the non-communicable diseases weren't there in the Millennium Development Goals at all, but of course that's changed. The other buzz phrase that's applied to human development very much over the last, I suppose, 8 to 10 years has been the 1,000 days. Well, we haven't heard that this afternoon because from what I'm hearing from your views, actually 1,000 days is not right. It's too late. If it starts at conception and goes on to year 2, do we need to redress that in some way, or should we just say, yes, well, that's fine, but you have to be prepared for the 1,000 days? Does anybody have a view on that? Lucilla, you're looking very much...
I'm absolutely... I don't think the 1,000 days has done us too much good at all, really, because it's incorrect, isn't it? We all know that from birth onwards, nutrition has to be very important. I think what I've been particularly impressed with is some of the national programs, like we just heard from Colombia. I mean, that is really impressive. Why can't we all have a program like that? That would be wonderful in the United Kingdom as well, where we have foci of interest, whether it be in folate supplementation or breastfeeding, adolescent health, continuing with folate supplementation. I mean, all those incredibly useful tips for other countries. And the other thing which I think has come to the fore today so much is the local myths about nutrition. I mean, surely we can do something about that. You know, that there's so many of these myths could be dispelled in a way which had to be culturally sensitive, but I was not aware quite so much of how much these impact upon nutrition of the mother and the child and adolescents. So I think those are two things which I've really picked up from this discussion, which I think are incredibly useful and that we can do something about, you know.
And as I say, they are instituted because people think they're good for the child. So we're building on a positive platform here. So who would like to, Fionnuala, could ask each of you, I think, to address that because it relates to research directions, both in terms of knowledge, but also in terms of implementation, the practicalities. Sorry, Fionnuala.
Well, I think the two need to continue in tandem. But I think, I mean, there's quite a body of research and evidence available to us that maternal nutrition is important, preconception and post-conception and into childhood. So I think we need to act on that now and really address the practical implementation issues. And that's not to say that we won't continue doing the research and the randomized trials and so on. And the Mavidos study does answer some of those questions around the vitamin D. But I think the challenges are much more in implementation. And I think what's come out of this afternoon is hearing the different countries, their strategies, gives us lots of ideas. Like in Turkey, the doctor is penalised if he doesn't seek out the pregnant women within his group.
Yeah, great
so
idea.
That may work. That might be something for many of us to consider in our own groups. The fact that in Turkey any woman can deliver in any hospital without charge. Again, we know that finances are a barrier to people in Africa, for example, attending institutions because they have to provide some of the materials for the birth itself. So I think the challenge is much more on the practical end, while the research is very important and will continue on. And I think it was useful even discussing what some of those practical issues might be. And certainly, you know, food fortification is one area, education from a very young age is another area. But these are issues that are common to all countries that I think we can really think about how to implement.
Lucilla? Did you want to each have a crack at that question, though, just to, and then we'll come,
Yes, I mean, I think you're quite right that there are around vitamin D. I quite agree with you, and you know, the question in obesity, which I'm been involved with, is to whether women are really vitamin D deficient, as they seem to be, and there's an awful lot of discussion about optimal vitamin D, and certainly the amount of vitamin D that one should be supplementing, which seems to be huge in order to be able to get vitamin D levels up to anything like reality. So yeah, there's a huge amount of work done there. But I think, you know, so much in recent years in nutrition has informed us enormously in the research field, and I think one of the most disappointing areas has been that whether it be protein or carbohydrate mixed supplementation doesn't improve birth weight really very much, and nor do any of the micronutrients really improve birth weight to a way we would like to see. I mean, that's been fantastically good research, which has actually instructed us to go to the preconceptional period. So I think despite the disappointments, that's been hugely valuable, and certainly you'll be hearing soon from a big massive study looking at gestational weight gain and trying to prevent that in obese pregnant women and in normal weight pregnant women, that is actually extremely difficult to do to a degree where it's going to influence pregnancy outcome. And I think there again a lot of studies, including my own and another by Fionnuala, will show that, you know, whatever we try and do during pregnancy in terms of obesity, it's really just going to be such a difficult ask of the women, and we're going to have to go preconceptionally. So research has had a massively important directional guide for us, but of course there are many things which still need to be done. But I would agree with Fionnuala that implementation is hugely important, and we were having a discussion just at the end of the last session with Dr. Buta, where of course we all know that as soon as people become more affluent, fertility goes down and nutritional status goes up. So we go right back to the gross national products and income, and it's about poverty very often. And so this is going back to number one problem, isn't it? So we have to think about that too at the greater level.
So I don't want
Emily.
to be redundant with anything that was already said, so I'll just add that I think that I agree, of course, with the previous two opinions, and I would add that, you know, one of the dangers of research is that it can be very reductionist. In order to conduct a really well-designed intervention, often the question needs to be so narrow that it's often not relevant for a large segment of the population. And so I think that we need to, even when the data are not perfect, we need to move ahead and not get overwhelmed by the multiple pieces that are necessary, because we know that public health can change and improve, and not be too disheartened by the fact that there are so many streams that all come together. And it seems to me that one of the most important things that needs to happen is this sort of shift in public will. And I think about, you know, smoking as the main paradigm in the US, where it seems like such an intractable problem, but at some point the tide can turn, and at some point we can start to really get this just absolute, you know, so if you see a pregnant woman smoking on the street, everyone would be sort of horrified immediately in a very visceral way. And I think what it would be nice if we can get, you know, see a pregnant woman being refused care, or, you know, turning to junk food, and everyone would then say, oh, that's just not the way it should be. Of course, you know, every pregnant woman should be given the best nutrition and care.
Luz.
Your question generated so many reactions in me that I really don't know. I'm sure that I'm not going to be as articulated as they are in terms of research. On the one side, I have the researcher side that tells me, yes, we need more information. On the other side, we work in an organization that works with the most vulnerable in many countries in Asia and Africa, and we cannot stop ourselves from doing something, and we need to deliver some interventions. What we can do is document as we learn and share the experiences. We are lucky that we have two, I wouldn't lie if I say that we are responsible for two important successful cases in public health in nutrition: vitamin A supplementation in kids and iodine, salt iodization. Although we have not worked alone, these programs, it took 20 years for them to take off and reach a decent coverage worldwide. We still have cases like Turkey where the coverage of iodized salt is important, but not adequately adequately iodized. So we can work on implementation research on that, but still we have to work on making that intervention that has proven to be effective available to most of the populations. There are so many changes in challenges in nutrition, and so difficult to prioritize. I mean, we work with governments, and sometimes the decision making is not that easy. Tell me one thing that you know that work and that works, and that we can make it work. There are not silver bullets, but commitment is important. But it's not only commitment from a government change. It's from non-state actors and also from the academia. The academia, we are always looking for something new, deliver a new intervention, and that is fine. But sometimes at program level, we just need to continue to see some successes. Fortification is an area where we can see success, but for programs to take off, at least take 8 years, 9 years. Colombia, the case of fortification, as far as I recall, it started like 10 years ago. That would be the case of Mexico as well. And it's only until now that we can see the changes in the trends, because coverage has achieved appropriate enforcement education at different levels. We are talking about changing the behaviors of pregnant women, but also we have to change our own behaviors. It goes at different levels, policymakers and academia, professional associations, a little bit more of alignment.
Thank you very much. I think that's, excuse me, that's very much the objective of the second phase of our working group, to take, with the help of ambassadors and colleagues, a widening community, to take this forward so that it does become country specific. Can I just, before we move on, a couple of other questions, let me just turn, I don't know, who should I pick on? I think I've got tempted to pick on Fionnuala, really, as, you know, there's a slightly implied criticism of the obstetric community here, of FIGO. You know, you've just been in your ivory tower and you haven't realised the importance of this phase of life, one of Professor Dimner's 5 phases, not the 7 phases of man, but the 5 phases here. Not linking up perhaps to the preconception story, adolescent health, not linking up perhaps to the paediatricians. Is there a message that FIGO could take away from this?
Well, I mean, I think we're here, and that's a fantastic start. Yeah. And we're talking and we're thinking. So, you know, we need to start somewhere. And obviously, as obstetricians, we're going to start preconception, conception, post-conception, because that's what we know. But I think we're, as a group, obstetricians tend to be very collaborative. We work very closely with our paediatric colleagues, with our surgical colleagues, our medical colleagues. So we have a good history of collaboration, because we often need outside input when we manage pregnancies and complex pregnancies. So I think, you know, you have to start with something. We've got a fantastic guideline, and then I think with that, then we can start to work with our paediatric colleagues and public health colleagues to really develop this as a worldwide initiative. So I would say we need to start somewhere, and we have started, and we've got the conversation going, and then we can, with this document, go to those other groups to have a more life course approach.
And it is in many ways, that we were just saying at tea, this kind of focus on the adolescent is there in many aspects of things that are going on, meetings that we go to, discussions. So it's interesting that in a way it is almost FIGO that's crystallising this in this way.
I think that the mother is a crucial piece of this, and one of the things that I'll be talking about tomorrow in the postpartum period is the importance of, you know, return to maternal good health, as well as health for the baby and also health for future pregnancies. But I think it's essential ultimately for women to value their own health as for itself, and not just as a vehicle for promoting child health. Especially because, you know, grandmothers are also important for raising healthy children. We want to keep these women healthy well into later life.
I think that's particularly the case for gestational diabetes, where very strong association with later type 2 diabetes, where nutrition can play a very, very important role in that. And certainly I think most of us who are involved in pregnancy cohort studies, Fionnuala and I were just talking about this earlier, we're very keen to follow up the mothers as well as the children. because of increased risk of cardiovascular and metabolic disease.
Yeah.
So yes, I think although we haven't talked about that principally today, I think everywhere I go and people doing these mother-child studies having increasing interest in the health of the woman in later life. Yeah.
And I would just add that we know that women who experience pregnancy complications, not only gestational diabetes, but also preeclampsia, that's a marker for maternal, long-term maternal health and cardiovascular risk. And I think we need to take that opportunity to identify the high-risk women so that we can continue additional focus on them for longitudinal screening.
Luz, did you want to come?
Actually, just to reinforce that point, we started at the beginning this exercise with maternal nutrition, and then we realized that it was not possible. We needed to go back because what matters is women's health and nutrition. So pregnancy is a particular event, and of course it's important, but then it starts a cycle, and we need to pay attention to, all these reproductive years. Not only because of reproduction, but because women have an important role in society for many other reasons.
So please, it's a very important point though. Please do read our guidelines and scan that and make sure that that message is coming through, because we had hoped to thread it through all the way that, it's critical for the woman, for her future, critical for the next generation.
I think what this document is trying to do is to stimulate interest, excitement, wanting to get out there back to your own countries and do something. They're recommendations, they're not guidelines, and that's the difference actually. And very interesting to hear today, which is, I think, somewhere we can do a lot. A lot of countries don't even have any guidelines. So that's not that difficult to rectify as an international community and with the expertise that we share. So maybe one of the things that we could take away from this week is that we can go to certain countries and help develop guidelines. Nigeria, as you were saying, what local foods are rich in which micronutrients? What can we recommend to young girls in Nigeria to eat? Those sorts of things are not that difficult. It's not rocket science, and it's known that evidence is there. So I think that's something that could come out of this, that we could rectify that very basic problem, that there are no guidelines in so many countries, which is just unbelievable in this century, isn't it? And that will help. I think that could be a good start.
Thank you. I think the other point that you made was that there's a need to educate the policymakers and government to provide. They may well say, yes, well, this is jolly interesting, Professor, there's lots of lovely information in here. What do you actually want me to do? What's it going to cost? And why should our government spend money on this rather than something else? So there's an advocacy message activity that we need to be working on individually and collectively, and I think that must be part of going forward too. Fionnuala, did you want to come in on?
Yes, the document is quite comprehensive. I suppose we had hoped that people would take the parts relevant to their own countries. Their evidence is there, the boxes are there, and then they could use this to interact with the policy, with the government makers, with the public health physicians in your own country. So it would be hoped that it would be used as a resource, that you could then take out the relevant bits, and with all of the backing documentation there, so to assist people in that advocacy role.